Hello, I'm Dr. Dolce, and welcome to the next in our series of pain education classes. Today what I'd like to talk to you about is a very important process, the process of grief and acceptance. It may seem like a rather strange topic to be included in pain education. However, it's a highly important process, one that is, I think, essential for folks to actually move forwards in their life and reestablish a healthy, happy life. To begin with, what I am going to cover today is a concept of self-management and acceptance. And then as we move through the talk, I'd like to talk a little bit about the important difference between grief and depression, and then follow that with the process of grief itself. And each of these components are essential, I think, into understanding this whole concept of the process of grief and acceptance as it relates to healing. In terms of the main process of acceptance and self-management, there's a goal to this. The ultimate goal of the process is to accept and maximize your health and wellness and to achieve the highest quality of life possible. And I find that this is an important process in the sense that without this process, people have a very difficult time beginning to make that journey from an illness and being incapacitated by whatever symptoms are there for you, to one where you're actually living your life to the fullest and getting a high quality of life. You might ask, so what is health and wellness if you have a chronic illness? It sounds very contradictory at best. However, there is an important distinction here, that you can have chronic illness and still have a high quality of life and health and wellness. To understand this process a little bit, you have to understand some of the definitions of illness and disease. If you look at illness and disease, they're really separate things. Disease itself is a physical limitation, something that's caused by a process or damage to the body. Illness, however, is a combination. It's not only just the disease process itself, but it's our response to that disease process. And it accounts for a lot of the differences that you see in our clinical setting. You see somebody that comes in with a back injury, injury to their lower back, and may have a fusion at 2 levels, at L3, 4, 4, 5, and they may be very impaired. They have difficulty getting up, traveling, moving around, and yet you'll see somebody else who's had scoliosis and had a severe fusion of their back. And I'm thinking in particular of this one woman that we had in the clinic that had her neck fused, her back fused from her neck to her hips with 2 steel rods. And yet every day she got up, got in the car, drove 2,000 miles as a regional sales rep during the week, and functioned at a very high level. And yet the disease, the state of her body, was severely more impaired than the other individuals, but the response and how that person lived was dramatically different. So you can't always equate the actual disease process with illness. And so there's an important distinction. You have to be careful how you talk about things and not label how you live based on your physical disease process. The other aspect that's important to understand is the difference between curing and healing. By that, people are often looking for cures with chronic illnesses, something that you can do to eliminate, get rid of the disease state. However, by definition, chronic illnesses have no such type of answer. If you have a chronic illness such as diabetes or other illnesses such as a stroke or spinal cord injury or chronic pain, there may be very little that you can do to ever eradicate the disease process itself. So you can't cure it. However, that doesn't mean that healing is not possible. In particular, you might look at examples of people with cancer. It's a disease state that sometimes you may have a terminal cancer where there's no way to cure successfully what the person has. But that doesn't mean that they can't heal themselves in their life state. And they can restore their relationships with other people. They can go on to enjoy their life and have meaningful activities and be productive to some degree. It's a rather startling thing. I've heard it more times than I can count when I have worked in the area of sort of terminal illnesses, when somebody who's dying looks at you and says, "I don't really want to die. However, this is the best thing that's ever happened to me." And they often mean something along the lines of this, that they don't want to die, but they were in a bad spot in their life. They were focusing on the wrong things. They may have been workaholic. They may have been ignoring their relationships with their family or friends. They may have a variety of different things that were occupying all their time, energy, and that were relatively meaningless. And now that they have an incurable or terminal cancer, that they're starting to focus on the things that are important. And they'll say, I may only live 6 months, but every day I live my life to the fullest. I enjoy my life. My relationships are better. My relationships are healthier. I'm not fighting against things that are unimportant and wasting my time and energy. And so there's a true sense of being able to heal even though you can't cure. So when we're talking about health and wellness with a chronic illness, we're talking about focusing on these aspects of things. We're talking about focusing on how to live well, how to repair your relationships with other people, how to change your life so that you're getting a high quality of living, finding things that are meaningful, things that you can be passionate about, and the capacity to enjoy them even though that there is some sort of disease process present. When it comes to health, wellness versus illness, one way of thinking about the definition, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that's the definition by the World Health Organization. Health is not the absence of a disease. It is something positive, a joyful attitude toward life, a cheerful acceptance of the responsibility that life puts upon the individual. That's a separate definition. And both of them are capturing this dimension of wellness with chronic illness. And in particular, what they're focusing on is the fact that there are dimensions besides the negatives that are important to whether we feel well and healthy. When we're talking about being physically fit, for example, you might have an impairment that makes you not physically fit. You may have had a broken leg, but having that healed does not make you actually physically fit. We typically think of those things as being more robust, one where we're cardiovascularly fit, can exercise, that we're strong, agile, and much, much more than just not having some sort of physical limitation. So in essence, when we're talking about health and wellness in relation to chronic pain, we're talking about how do you live your life even though you hurt on a daily basis. How do you live it in a way that is productive, that you can have something that is meaningful, that you can enjoy your relationships and not have something less than what you had previously before your problems arose. So how do you achieve health and wellness if you have a chronic illness or chronic pain? Well, it's through a process of grief and acceptance. The process of grief and acceptance is the primary topic of today's talk, but I'm going to put that off a minute till we talk about self-management, which is also equally important in this process of healing. Self-management is characterized by an understanding that your chronic pain or whatever illness you have is a bio-psychosocial behavioral issue that affects all of you. And by that I mean there's the biological component. You may have a ruptured disc, you may have fibromyalgia, you may have a neuropathy. There's some sort of biological aspect to the disease that you have. But there's also a psychological aspect to it as well. Many of you probably are well aware of the fact that when you are anxious or depressed, that your pain is worse, that there are a lot of emotional aspects. You hurt and it limits what you do, so you're more upset. You may be angry over what's happened, you may be sad and depressed over what you can't do, and you may be scared about the future. And those things arise out of the condition, but they also feed back onto the condition and determine to some degree how you feel and the pain that you feel. There's a social dimension to this. Our conditions don't occur in a vacuum. When we're sick, we have families, we have marriages, we live in a society, we have jobs, and all of those things have implications for how our illness gets played out, where our limitations are, and how those things affect how we feel. They're behavioral issues. It's a very common trait to see people that come into the clinic and they'll tell you of a pattern that they have bad days and good days, and that on their bad days they're totally incapacitated, but on a day that they feel better, they get up and they overdo it rather than pacing themselves, and they wind up flat on their backs. So it's an issue that in order to move forwards and get to the highest state of functioning that you can and achieve a sense of wellness, you have to be able to address all of these and address them all in an effective manner. And to do this, you have to take responsibility. You have to take personal responsibility for this whole process. And by this I mean, if you were a diabetic, you can't just rely on the doctors to provide you with the right medications, the insulin, or the things that you need. Because no physician will be able to heal you or help you if you go out and eat a large amount of sweets, gain a lot of weight, don't exercise, drink alcohol, because those things overpower the physician's capacity to provide treatment or to provide medications. So there has to be a sense of personal responsibility to not only follow the physician's instructions, to do what is asked of you in terms of using your medications correctly, to maybe exercise, to lose weight, to quit smoking, the things that actually have an impact on the disease that you're treating. And then you also have to work toward restoring new meaning. And this is part of the key to grief and acceptance. You're moving and transitioning from a place where you were in your life doing certain kinds of things to reestablishing a life with a new normal, so to speak, a place where there's new meaning, new activities, things that may be very different than in your previous life before you were injured or sick, but are every bit as rewarding and fulfilling. When it comes down to it, the important part of this is attitude. And I don't know whether you've ever heard this before, but it's a wonderful quote. The only true disability in life is a bad attitude. And you'll see people with very high levels of disease, lots of things going on, that just can't seem to be held back because of their attitude, their hope, their optimism, their inspiration for what they want, their desire to have a full life. And then you'll see folks with very little disease sometimes who seem to be limited and held into the recliner or staying in the bed because of a perspective. And so you have to keep the right attitude, and an attitude of optimism and hope, and considering all the things that your life can be. And this brings us to acceptance. Acceptance, as a formal definition, is an act of taking or receiving something. So when we're talking about acceptance of chronic pain, that means willingly, intentionally accepting the fact that that condition exists, that it is there. You can't change it by definition. If you could, it would be gone. But this is something that you have, and that is going to be with you. And you have to accept or receive, if you will, the new life that's you have with the symptoms that you have. So you have to assent to it mentally and emotionally. You have to be willing to pick that up and say, all right, I hurt. How am I going to live my life? So what do I do now? And it's that attitude of acceptance of that with some sense of hope and optimism that leads you toward a healthier life, a more meaningful, fulfilled life. In terms of acceptance of your pain, I get a lot of strong reactions from folks sometimes when I say that. How can I accept my pain? People think that sometimes it's giving up or giving in, or that you'll never get better, or that this is as good as it gets. It's a hopeless type of feeling. And again, optimism's important, because acceptance isn't that. It's really sort of a different kind of perspective when you get to it. It's not this sense of, well, I've got this thing, my life is over, I might as well accept it that it's never going to be better than this. It's a positive step. It's not giving up in that sense. It's a sense of awareness that life can be more than your circumstances, that it doesn't matter whether you're under bad circumstances and hardship, having pain or difficulties, or living well in terms of a good job or more higher level of functioning. It's your response to those events, those circumstances and situations that really define how you live and your acceptance of your life. One of the things that's important to note is that higher pain acceptance really is associated with living your life better. The research is really very clear. When you look at folks that have accepted their pain and are no longer trying to fight their pain or change it, that they actually have less attention. They're not preoccupied as much or focused on their pain. They're actually focused on living their lives and enjoying their lives. They're doing more things, so their daily activities are higher. They're more engaged with family, friends. They're involved in more social events. They may have Bible studies or other groups that they attend. There are things that they're doing. They're more motivated to do activities. They're using less medication. Their moods are better. So accepting of your pain actually helps you with things such as depression, anxiety, anger. Work status is better as well. So you'll see people who can work, more of them are doing that with a better acceptance of their pain. And if you can't work, you're still functioning at a higher level. There's more of a sense of independence and an overall quality to your life. The key to acceptance is grief. And this is the primary focus of today's lecture or presentation. It sounds funny to think of grief as the key to acceptance, but you can't accept something until you let go of what you were holding on to. And the only way you let go of something to move forwards is grief. So if I'm holding something in my right hand, if I'm holding something, I can't pick anything up with that until I put this down. So if you cling too rigidly in your own thinking to the life that you used to have, the only way to live was because I did X for my job, or I lived to play golf, or I was a hunter or a fisherman, and that was my life, and I can no longer do that, so my life is over. Well, then you've got a problem. The way you move from that state to one where you can accept where you are is you have to let or put down that concept of yourself as defined by what you did and how you lived your life, and start to grieve that, because those things were meaningful. You can't deny the fact that they were meaningful and important to you, and then move forwards to be able to embrace what your new life holds with your limitations, whatever those limitations are. Now, this is where people get stuck. People all the time are going, but that was meaningful. There's no way I'm going to enjoy my life as well now. There's no way. And that's not true. The process of grief and acceptance is really one that transforms you, that lets you go, you're letting go of what you were holding on to that had very deep meaning and important meaning. And there are a lot of examples that you probably have in your own personal experiences that you can't quite think of in that term, but are true. For example, if you had a prior marriage and then that marriage ended, and that marriage was meaningful to you, you might at first think that you're never going to have another meaningful relationship. But most people find another marriage or relationship that is satisfactory or happy. One of the best examples I have, and the one I like to give, is about dogs. And I don't know how many of you are pet owners, but if you've had more than one pet and have lost a pet, you probably can identify with this. You may have a dog that is a very, very sweet dog, very sweet animal, great disposition, and that dog dies. Well, the next dog you get won't be like that dog. The temperament will be different. How they play, how they act, their mannerisms, completely different. But I know from experience, as many of you might know as well, that you love that dog just as much. That dog is just as important in your life, just as meaningful, and it's different, but equal. And that's the point here, is that by letting go of and working your way through the grief process over how you used to live, frees you up to have a different life. It may look radically different in terms of what you do on a day-to-day basis, but it doesn't have to be less than what you had in terms of the meaning and enjoyment that you get. Grief and depression. Regarding grief, one of the things that I think is important to understand in this is that there's a difference between grief and depression. It's one of the primary reasons that I believe that people have difficulty making this transition. It's a fundamental misunderstanding to confuse a clinical depression with grief. And everyone seems to do it, not only just individuals, but your doctors do, physicians do, psychologists and psychiatrists are equally bad about missing grief. It's something that's been driven home to me across the years in working in rehab centers, that we so often, when somebody presents with certain symptoms, say, oh, they're depressed, and begin to treat them like they're going through a depression, when actually what they're doing is grieving aspects of their life. It's important to understand this difference, because clinical depression isn't normal. It's an illness. It's something that does need to be treated. However, grief is a very, very normal process. It's the way that God has set up our brains to heal from loss. It's a normal process and something that's essential for us to be able to live our lives well. Another fundamental misunderstanding when it comes to this process of grieving is getting ahead of yourself, okay? You can't really grieve, accept or pick up a new lifestyle until you've actively worked your way through the grief process. And so we're going to talk some about that too in a little bit. But first I wanted to talk a little bit more in terms of what I mean by grief related to illness. People don't always relate to that. However, there are a lot of losses that are associated with your illness. You may, if you've known somebody who's had cancer and lost a body part, such as a mastectomy, you may think about that they would grieve that change in their body. But even if you haven't lost a body part or a limb, there's changes. We're not as strong, we're not as capable, we're not as flexible. Our bodies in a way betray us, and there's a sense of change in how we think about ourselves as strong, healthy, well, to one where we see ourselves as weak, sick, or disabled. We can't function the same way, so we can't handle the things in life as well. We're used to comfort, and we lose comfort with chronic pain. A day-to-day life with chronic pain is not comfortable. We lose control. There are things that we don't have control over. Productivity. We're used to being productive, getting up, knocking out our responsibilities, getting the grass cut, getting the house cleaned, doing the things we need to do for our kids or our family. Purpose changes. We may have been living to work or focusing to raise our families, and now the things that we do are different, and the purpose and meaning in our lives seems to change. Our routines change. One of the key things I think that we'll see is that people's self-identities change. So oftentimes I hear people looking at themselves in ways that I'm sick, or I'm damaged, I'm broken, I'm disabled. And that concept is a very important one, because you actually grieve or feel a sense of loss when you feel yourself changing. And you'll hear comments from people such as, I'm not who I used to be. And that's true. And so there's a process of grief around that. Our hobbies, again, the things that we do for our lives that are meaningful, if you can't do them, then it's distressing. It's painful to lose those things. Jobs and the work we do, we identify as, men are really bad about that, identifying ourselves through the work that we do rather than who we are. Finances change. You might have a loss of income that changes your lifestyle, and you may grieve or miss what you had. Intimacy, our physical relationships, if you're married or in relationships, sex changes. Social support, when you're sick and ill over a long period of time, initially there might be a lot of people around, but over time there's a tendency for your social relationships to change and some people to drift off. It can impact our sense of God and life and faith. And so there are a lot of things that take hits, that are damaged, that you actually have an emotional loss to that needs to be grieved in order to move forwards. So when you get to this concept of grief and depression, what's the difference and why are they important? Clinical depression, by definition, and this comes from the DSM-4, the current diagnostic manual that's used to present the symptoms to diagnose depression, says a clinical depression or a major affective disorder is not just feeling sad or down. It's a syndrome that has a range of emotional, physical, and cognitive symptoms or mental symptoms. And if you look at the list of symptoms that are there, you'll see a change in mood. So people may be sad, irritable, angry, anxious, guilty. You don't even have to be sad. You'll see people who are depressed that aren't sad at all. They just may be very anxious or irritable. Sleep will change. Most of the time people will tell you that they lose sleep, they can't sleep. They wake up early in the morning and can't get back to sleep. Sometimes you'll see people that they say all they want to do is sleep 16, 17 hours a day. Energy changes. You'll see a loss of energy, or sometimes people get tense, keyed up, and agitated. Appetite changes. Typically you lose your appetite, but some people eat more. There's a change in mental ability, so your capacity to concentrate, to remember things, to make decisions changes. Memory, you get more forgetful. You have a loss of interest in life. Things aren't enjoyable, which is called anhedonia, the loss of enjoyment. You become more withdrawn. You pull back from others. You may have feelings of helplessness, hopelessness, worthlessness. You may have thoughts of death and suicide. So when you've had a list of this list of symptoms, anytime where you have 5 or more of these symptoms over a period of 2 weeks, you start to suspect that there may be a clinical depression present, because they're not typical, they're not common in life. And you'll see these if you're going through them. It gets complicated when you have a chronic illness like chronic pain, because many of these symptoms are also associated with the pain itself, problems sleeping or loss of energy. So you have to be careful in the diagnosis. But when you are depressed, these are the symptoms that you have. Now, in terms of what grief is emotional suffering. It's caused by the loss of something that is meaningful. Again, there's a constellation of things that happen when you're grieving, changes in your thoughts, your feelings, and your activities, but they're all designed by your brain or God for you to be able to work through letting go of something that is meaningful to you. It's a way of detaching from it and healing. But if you look at the symptoms of grief, there's a change in mood: sad, irritable, anxious, guilty, shameful, change in sleep, decrease or increase, change in energy, increased or decreased, appetite changes, concentration problems, decision-making problems, forgetful. You change in interest again, loss of interest, things feel flat, you withdraw maybe from others. You feel helpless, empty, or alone. You may have more thoughts of death. So as you go down that list, you might notice that there's a strong similarity to the symptoms of depression. They're almost identical. What seems to differentiate the symptom list is you typically don't see hopelessness with grief, and you don't usually see somebody thinking of taking their life. And they may have more thoughts of death and dying, but they don't typically think about taking their own life. So it's a very, very fine line if you just look at the symptoms about whether somebody's actually grieving or depressed. But it is important because while these similarities in symptoms are there, there's some other differences that make it essential to understand. The causes are very, very different. With depression, there are three primary areas of causes. There are biological types of depression, such as bipolar disorders that have a very genetic basis or some biological predisposition to be depressed. There's changes in your thoughts that drive depression so much of the time, and changes in the amount of meaning in a life relative to the hardship of life. So in some ways, depression is caused by an imbalance between the things that are difficult in life and the things that are meaningful. As long as meaning is high, then the things that are difficult don't seem to be so difficult. You might look at hospice nurses. Very, very stressful, difficult job, a way of living, a lot of negatives, a lot of very stressful, hard things that happen every day. And yet the meaning that they derive from doing their work seems to offset all of that. Depression starts to creep in when that balance changes. So if you've got an illness such as chronic pain, and all of a sudden you can't go do the things that you used to do that were meaningful to you, there's a loss of that meaning. Relationship changes, there's loss of meaning. Then you start adding things such as pain, which is a negative. You start adding things such as expenses, doctor's visits, financial problems, and the things that go along with that you get an imbalance between the negatives of life relative to the meaning. And this begins the depression process so often. Another important distinction is this difference between what's natural and normal as a process of healing with grief versus something that's not so normal, such as depression. And they really are different, and you need to conceptualize them different, because if you approach them the same way, then you're going to have problems. Treating is different than healing. Treatment for depression is very focused on certain sorts of things. What happens with treatment with depression, you have to attack those underlying causes. Maybe medications to address the underlying biological aspects, working to change your negative thinking, to look at life in a stronger, more positive way. Maybe getting out and being more active to get more meaning in your life. And those things are helpful. However, they can also provide barriers to the grief process. They're very, very different processes between treating depression and the grief process itself of healing. And the primary difference is that with depression, you have to fight your symptoms. You have to push yourself to do things. You have to sort of grab yourself by your own bootstraps, pull yourself up, force yourself to get on with the day and the activities and make something happen. With grief, if you do that and sort of deny your feelings, you stop the process. It's important when you're grieving to allow yourself to feel the loss. And without feeling the loss, you can never work your way through that process. So anything that you do in terms of treatment of depression where you're trying to dampen down those emotions, such as adding antidepressants or even pain medications that numb your feelings or dampen down your feelings, interfere with your capacity to heal, to work your way through those losses and changes. So it's a very important distinction to make. There are other barriers to the treatment of grief and acceptance. that you run into besides those that are related to the processes themselves. And what you'll see is that providers, your doctors, can cause problems. If they're so focused on having you do more that they're not paying attention to what you feel, not giving credibility or empathy to understanding what you're actually living with, they can push you inadvertently to try to get ahead of yourself and do things before you've really worked your way through those losses. Coexisting depression is a problem. It's not an either-or thing. You can be depressed and also grieving. And this complicates the process extensively, because what tends to happen is as you start to grieve, you start to experience some of the emotions, sadness or anxiety, whatever that emotion is. And as that emotion starts to happen, it tends to kick off the negative thinking of depression. And then that depression takes over and shuts down the grief process and takes you off in a very negative direction. And again, medications can be very detrimental sometimes to the process of grief. If you can't feel the loss to work your way through that loss, you'll never heal. There are mental barriers too, in terms of individual personal barriers. You can get stuck. We see it so often that people are so focused, I've got to find the right doctor, the surgeon who's got the right procedure or that magic medication that's going to, quote, cure me, get rid of my pain and make everything well. Well, as long as you're searching for a cure, you've not really come to terms with the fact that what you have is there and that you're never going to really be able to work your way through that loss because you don't recognize it as a loss yet. There's a fear of giving up, and that sometimes can interfere. You can work so hard at trying not to give up and staying active and involved in what you're doing in life that you never let yourself heal from the losses and the things that are occurring. You can fear the pain, and accepting of the pain and working toward living with it on a day-to-day basis is difficult sometimes to think about. You know, we want to feel well. We're really eager to find medicines and things that take away our pain, and that's different than accepting the fact that I hurt and that I'm going to hurt sometimes and that I need to find ways of doing the activities that are meaningful to me or replace them with other things that are meaningful even though I hurt. You'll see folks that sometimes get stuck in concerns that if they move forwards and accept that their pain and aren't so focused on it, that others won't really know that they're hurting. That they'll feel like, well, people won't really know my struggle, my personal difficulties, and that in and of itself can be distressing. So there's a lot in terms of mental attitude that actually interferes with your ability to be able to work your way through the grief process. The grief process itself, I guess the most popular and well-known aspect of grief is Kubler-Ross's 5 stages of grief. That first stage of denial, not really being able to grasp that what you've lost is gone. Anger, not understanding why. Bargaining, trying to figure out some way of getting around the loss or replacing it or negotiating with it. Depression, a sense of hopelessness, if you will, that it's gone and that you can't change it. And finally, a process or a step of acceptance where they can see their way forward. And it's a useful model and in so many ways is descriptive of many things. However, from a clinical perspective, I don't find it really useful in the sense that I don't think it gives people a lot of guidance in terms of understanding what's happening on a day-to-day basis because the process itself is really much more confusing. Warden presents another task model. One that I think has more utility and is more helpful. And really what he defines is 4 and possibly 5 tasks that vary where you are in the process. And the first task is really to accept the loss, to understand that what is there isn't there. And that is a very broad kind of concept too, because it also includes this concept of understanding the loss. For example, if somebody that you know has died that was important to you, the thing that most strikes you at first may not be the only aspect of that relationship that's lost. So as time goes on, you start to see deeper and deeper meaning and deeper connections that only show themselves bit by bit. And it takes time to have that awareness. I saw a gal, she was in her mid-20s, came into therapy, thought she was depressed. And her mother died when she was 15. she went to a grief process and managed it quite well, went on to her life and had gone through college, got into medical school, was graduating medical school and about to get married. And she was depressed and sad and couldn't understand why, so she came into the office thinking that she was depressed. But in reality, it wasn't depression at all, it was grief. Because at 15, she wasn't able to get her head around what she really had lost. She could understand the loss of a 15-year-old, but she couldn't conceptualize at 15 the loss that she'd feel when she was walking down the aisle to get married or graduating, and that her mother should be there to see that, to be part of that. And because that awareness was only bubbling up now, she was beginning to experience the sadness and that sense of loss around that. So it's not a very linear process. People sort of bounce around in it. They move from one task to the next, and different things come up at different times. But once you understand what the loss is, the next task is to experience the pain of the grief or the emotion around it. And to this extent, the loss or the emotion that you feel around that loss is always going to mirror it. So if you have somebody that was an individual that showed you unconditional love, the emotion you might experience is deep sorrow or sadness. If it was a person that you had some dependency on, maybe the person you went to when you had a problem for advice or somebody you went to when you had financial problems, then the awareness that they were no longer there might produce anxiety. If the relationship that you had was more mixed and there were problems in the relationship, you might have anger or mixed emotions. So the emotion that you experience in this stage is always sort of related to the nature of the loss that you had. So the first task is to understand what you've lost. The second task, to experience the emotion around that. In essence, what you're trying to do here is wear off the emotion from the thing that was meaningful. Okay? And so what you're doing in a way of thinking about it is if you'd found an artifact, a family piece of jewelry up in the attic, and it was tarnished and corroded, and you began to rub it with your fingers or thumbs, and the more you rubbed, the more of the tarnish you were rubbing off, but your thumb got cut and it was bleeding, it was hurting, and you kept rubbing, and eventually you rubbed all the tarnish off and your thumb healed up. There may be a scar from the cut, but the pain's no longer there, and you're left with this very shiny piece of jewelry that's a family memento. And the same thing's happening with the grief process. What you're doing is converting something that's in the present in your life, a real relationship or something in present time, and you're converting it to something in memory, as something that isn't currently in your life, but you have memories of. In order to do that in a way is you have to kind of peel the paint off or rub the paint off of that item in order to do that. And if you avoid the task of experiencing the emotion, then what you're doing is you're beginning to block your ability to have those meaningful memories. And you see people who can't quite work their way through the grief of the loss of an individual, for example, and they can never think about that person without tears and crying. And because of that, they can't ever remember the good times. They can't remember the fun things, the things that made that person real, and all the things in their life that were enjoyable. So there really is value to the process of grieving. After the second task of sort of wearing off the emotion, if you will, the next is to begin to put up or let go of those tasks. And in terms of things, this is with a person, it'd be the time where you start thinking about packing up belongings or getting rid of clothes or cleaning out a room. Regarding an illness, in terms of a chronic illness, it may be the point where you say, well, you know, those golf clubs that are sitting in my garage that haven't been used in a year and a half now, maybe it's time to sell them and get rid of them. So you start letting go of those things that you don't need anymore. The fourth task, if you will, is to begin to fill those voids, to begin to add new things in that have new meaning. So you pick up new hobbies. And again, the important part here is that these things aren't going to look like the things you used to do. If you were very vigorous and like gardening and landscaping and taking care of your yard, you may not be able to do that. But that doesn't mean that you can't have a garden on your porch in flower pots and raise herbs or other types of flowers, or have orchids in the house or African violets in the window. You may not be able to play softball any longer, but you may start to coach, or you may become an umpire and call games. So there's going to be a shift in what you do. And the important part to remember about this task is that different doesn't mean less. It just means different. And the task here is really to take things that were very, very meaningful and find new tasks that are equally meaningful and enjoyable, but different. And there's a fifth task that's sometimes present, but not always present, which is the restoration of your own sort of theology. So many of the times our losses damage our concept of life and God, that we need some damage control and repair in those areas. You see folks that question God, why things are happening, the way events unfold. And sometimes you have to go back and think through your theology and redo how you think about God and your relationship to God. So that's an important dimension as well. So the goal of grief and acceptance, the ultimate goal of the process, again, is to let go of your old former life when you were able to do things. And despite the illness and the process, disease process, whatever it is for you, to move forwards and find new activities that are equally as meaningful, equally enjoyable, that brings the quality of life back to your life despite the pain. So it's a very important process, and one that I think is probably the most essential process in actually restoring your life when you're living with a chronic illness, in particular chronic pain. So I thank you for your time, and I hope this has been useful.